We discuss today hepatitis A virus infection. Hepatitis A virus infection is well known, and many people infected by hepatitis A virus, especially in children, may got the nausea, vomiting, mild pyrexia for 2 or 3 days and go on without any treatment. They suspect it is influenza in the stomach, but it is not that. It is hepatitis A virus. Hepatitis A virus, first epidemic of jaundice described by Hippocrates, differentiated from hepatitis B virus in 1940. In 1970, serological diagnosis of hepatitis B virus, therefore, when the hepatitis occur without B, without A, we call them at that time non-A, non-B, which later known as hepatitis C, hepatitis D, hepatitis E, and so on. Hepatitis A virus, an acute self-limiting disease. Not like hepatitis B, not like hepatitis C, does not cause chronic liver disease or cirrhosis, but is rarely fatal. It takes weeks or months for recovery and return to work, school, or daily life. Hepatitis A virus, a worldwide infectious disease. Therefore, the red, which is high risk people, but the pink, it is moderate risk, and the yellow is low risk people. According to geographical distribution, there is area with high endemicity, area of intermediate endemicity, area of low level of infection. The geographic distribution of this area, as we saw before in the map, the areas with high level of infection, this is in developing countries with poor sanitary condition, about 90% of children have been infected with the hepatitis A virus before the age of 10. These people, these children, become immune against the other infection with hepatitis A virus. Infected children do not have any symptoms, but they become immune. Epidemics are uncommon because older children and adults are generally immune. The infection during childhood, it is mild, asymptomatic, come and go without any marked symptoms. These children become immune. How we can know they immune? If we search for hepatitis A antibodies, we find they have hepatitis A antibodies, and therefore they become immune against other infection. Therefore, epidemics in these areas are uncommon because they already immune during childhood. Areas with intermediate levels of infection, regions where sanitary conditions are variable. Children often escape infection in early childhood and reach adulthood without any immunity, may lead to adult never infected, and who have no immunity. This older age group may lead to higher disease risk. Therefore, Egypt now, these these people in Egypt, some has immune and others not immune. Large outbreaks can occur in these communities. Contaminated food or water can erupt an epidemic in Shanghai in 1988, affected around 300,000 people. In Egypt, sometimes there in the school, all the children in the school become infected with hepatitis A virus and always close the school for these outbreaks in the children. Areas with low levels of infection, as in developed countries with good hygienic conditions, infection rates are low. Disease may occur among adolescents and adults in high risk group. Infective hepatitis A has been associated with poor sanitation concerning human excreta and wastewater. This is the poor sanitation and bed and water. This is poor sanitation. This is poor sanitation. This is the water, which is the cause of infection. But I think these children immune because they got the infection during childhood and not affected by a new infection. Also, as we see here, the water, also this is the water. Recently, there is pure water. Therefore, we transfer to the safe water. What is the problem? 2.7 million people die every year from lack of sanitation. Every 22nd, a child dies as a result of poor sanitation. Therefore, an increased levels of early infection in areas with high endemicity countries, but it has been reported an unusual 1,173 cases. These areas of low endemicity countries, 15 countries in Europe and Americas. From June 90, 2016 to 16 May. From June 2016 till 16 May 2017, about 1,173 cases. What is the cause in these areas of low endemicity and good sanitation? It has been found that the oral sex is the cause. Therefore, the World Health Organization make a World Hepatitis Day. This World Hepatitis Day marked on 28 July each year. Awareness and understanding of viral hepatitis. Also, from 2016 to 2021 adopted the first global health sector strategy on viral hepatitis, aiming of reducing the infection by 90% and reduce the deaths from viral A hepatitis by 65% in 2030. Therefore, we should discuss the transmission of infection. The virus is primarily spread when a person ingests food or water contaminated with the feces from an infected person. The disease associated inadequate sanitation and poor personal hygiene. Dirty hands when an infected person prepares food. Therefore, the problem in inadequate sanitation and poor personal hygiene and dirty hands. Therefore, inadequate sanitation, look for toilets. It is the problem of poor sanitation. The problem of poor sanitation, and if you go to any restaurant or any school, first go to the toilet. In the restaurant, if you found the toilet not good, go out from the restaurant immediately. You are dealing with bad food, not healthy food. Take care from money. Dirty hands. There is research on the paper money and the coins and put it in water and centrifuge the water. There are many bacteria in this water and fungus infection and so on. Therefore, take care from the dirty hands. Look, the nail. It is very bad. There is something below the nail. It is long and not healthy. Therefore, take care of the nail. This is nail but not good. It is bad, dirty nail. Their hand may have this bacteria. Therefore, the gloves is very important. And I hope for the chief in televisions to wear gloves just in front of the people to teach them that it is very important during preparing the food. It is not good not to wear the gloves. When poor sanitation and dirty hand persons, I insist, dirty hand persons, look for the hands for the person preparing food. And if you find him not wearing gloves, leave the food and please save yourself. Also, flies may carry the disease. The risk of hepatitis A virus infection in unvaccinated and previously uninfected people. Here, the cause of transmission of infection. This is the food. It should be, and this is the nails, and therefore may have flies, may the person making this salad a dirty nail, not wearing gloves, therefore there is transmission of infection. But in Egypt, as more 90% of children got the infection and become immune. But recently, with the development of sanitation in many homes, therefore, other people liable to be infected because they have no immunity, there is no have no previous hepatitis A virus, therefore liable to get the infection. For this food, you find the flies on this food, also the flies may got the infection. Therefore, stop microbes, use good hygiene, take care of flies, take care of everything as you see. Therefore, the best to stop microbes, wash your hands, wash your hands. Return back to acute hepatitis A virus. Has an incubation period of 28 days, maybe 15, maybe 50, but it is usually 28 days. Hepatitis A virus replicate in the liver and shed in feces 2 weeks before to 1 week after the clinical illness. The maximum infectivity is in the second half of the incubation period while asymptomatic, and most cases considered non-infectious after the first week of jaundice. Therefore, the infection is asymptomatic or mild in children, as we discussed before, but may be symptomatic and the severity of disease increasing with increasing the age. Adult may develop jaundice and present with more severe clinical symptoms. The case fatality ratio is generally 0.1%, but can be 1.8% in adults more than 50 years of age. It is not the cause, not cause a chronic liver disease. From 10 to 15% relapse during 6 months after acute illness. Acute liver failure is rare and fatality rate 0.5%. What is the symptoms? As we said before, it may be asymptomatic, but usually, especially in adult and adolescent, we got fever, nausea, vomiting, fatigue, jaundice, dark urine look like tea, pale stool, epigastric discomfort, loss of appetite. A person may have all or some of these or none of these. Anorexia. The patient hate to look for the food. When the patient cigarette smoking, he hate to take cigarette. When he like coffee, he hate to drink coffee. Therefore, the first thing the patient hate food, hate cigarette smoking, hate coffee, cannot make any of this in his life. May develop jaundice, and this jaundice yellowish coloration of the sclera. Therefore, if we conclude, therefore, viral infection of the liver spread when fecal matter enters the mouth, may last several weeks or can be debilitating, but most people recover completely. Preventable with careful hand washing. Careful hand washing. Please, careful hand washing. Keeping toilets and bathroom clean. Avoiding infective water source. The symptoms nausea, vomiting, spread by direct contact, food and beverage, cups and spoons, and any other objected by infected person. Therefore, how we diagnose? It is easy. Just ask HAVIGM IgM if it is possible. Therefore, there is acute hepatitis A virus infection. But if it is negative, but IgG positive, it means got a previous attack of hepatitis A virus. But it is easy to diagnose when HAVIGM positive. Rarely we need the PCR HAVRNA. It is rarely indicated, and I think I never used it because the diagnosis from the history, from clinical examination, from the serological examination, the diagnosis good. What is the treatment of hepatitis A virus? There is no specific treatment for hepatitis A virus. Recovery from symptoms may be slow and may take several weeks or months, especially in adolescent and adult. Encourage patients to have an adequate diet, not avoid the adequate diet. Avoidance of unnecessary medications. No medications. No acetaminophen, no paracetamol, no medication against vomiting should not be given. Therefore, the best treatment is to give nothing. Therefore, hospitalization is unnecessary for all cases, but sometimes when there is vomiting and diarrhea and loss of fluids, we should a replacement of fluids lost. Bed rest during the acute illness may be important. Restricting transmission is important, especially in the early phases of the illness. Returning to work should probably be delayed for 10 days after the onset of jaundice. Therefore, what is the complications? The hepatitis A virus may be asymptomatic, may be symptomatic, may be self-limiting disease, but sometimes got complications. What is this complication? May have prolonged jaundice more than 3 months, but resolves without intervention. Sometimes, and rare, we need corticosteroid and ursodeoxycholic acid may shorten the period of cholestasis. Acute renal failure, autoimmune hepatitis, and usually sometimes occur after hepatitis A virus infection. As with traditional autoimmune hepatitis, steroid therapy is indicated. Relapsing hepatitis A virus infection occur from 3 to 20% of patients with acute hepatitis A virus infection. Relapse occurs after a short period, usually less than 3 weeks of the initial presentation, although it usually is clinically minor. Please consider a new suggestion, which is the co-infection with hepatitis E in complicated cases, in prolonged cholestasis, in the relapsing, and so on. What is this co-infection of hepatitis A and E? Patients with hepatitis A had a greater frequency of hepatitis E infection in 25% of patients, probably because of similar routes of transmission for both hepatitis A and hepatitis E. The severe cases, cholestatic, relapsing, acute liver failure, may be related to co-infection of hepatitis A and hepatitis E. And it is very easy if you ask for the antibody of hepatitis E virus infection and you got it is positive, therefore there is a co-infection of A and E. Therefore, the prevention is better than cure. The prevention: adequate supplies of safe drinking water, proper disposal of sewage within communities, proper disposal of sewage within communities, personal hygiene, regular hand washing with water, vaccine. 100% of people develop protective levels of antibodies to the virus within 1 month after injection of single doses of vaccine. Some countries prefer 2 doses of vaccine. Routine vaccination of all children is now recommended because the level of sanitation these days is progressing. Vaccination of persons at increased risk, including travelers to endemic areas. We can conclude the hepatitis A virus infection can cause mild to severe illness. The hepatitis A virus is transmitted through ingestion of contaminated food and water or through direct contact with an infectious person. Almost everyone recovers fully from hepatitis A with lifelong immunity. However, a very small proportion of people infected with hepatitis A could die from fulminant hepatitis. The risk of hepatitis A infection is associated with a lack of safe water, poor sanitation, hygiene such as dirty hands. A safe and effective vaccine is available to prevent hepatitis A. Safe water supply, food safety, improved sanitation, hand washing, and vaccine are the most effective way to combat the disease. Therefore, take home this message: prevention of infectious disease, including hepatitis A and E, concerning good hygienic condition, human excreta, and safe water, and washing hands to stop microbes transmission. And I can say now thank you and hope you can understand what I have said. Thank you very much.